Now I am going to discuss about adenoidectomy. Indications: adenoid hypertrophy causing snoring, mouth breathing, speech abnormalities, and sleep apnea syndrome. Recurrent rhinosinusitis. Recurrent ear discharge in benign CSOM associated with adenoid hyperplasia. Chronic otitis media with effusion associated with adenoid hyperplasia. Dental malocclusion. Adenoidectomy does not correct the dental abnormalities but prevents its recurrence after orthodontic treatment. Contraindications: hemorrhagic diathesis, that is, the susceptibility of the person to bleed. Acute upper respiratory tract infections. Cleft palate, as adenoid removal causes velopharyngeal insufficiency. Insufficiency is the failure of the body's ability to temporarily close the communication between the nasal cavity and the mouth because of anatomic dysfunction. It is a temporary failure of the body's ability to close the communication between mouth and the nasal cavity. Procedure: rose position and general anesthesia is given. Later, adenoid tonsillectomy is done. When adenoidectomy is clubbed with tonsillectomy, adenoids are removed first and packed. By the time the tonsillectomy is finished, the adenoid bleeding stops. Method: Bailey-Davis mouth gag is inserted. Later, the soft palate is retracted with the tongue depressor to confirm the diagnosis and to assess the size of the adenoid masses and to push the lateral adenoid masses towards the midline. Later, using St. Clair Thompson adenoid curette, it is passed behind the palate till it touches the posterior end of the septum and adenoids are shaved off with gentle sweeping movements. Hemostasis is achieved by packing the area for some time. In persistent bleeders, it is controlled by postnasal pack for 24 hours. Complications: primary hemorrhage, reactionary hemorrhage, and secondary hemorrhage. And during the surgery, injury may occur to eustachian tube, pharynx muscle, or vertebrae. Injury to vertebrae may cause torticollis. Hypernasality. Due to large adenoids, palate grows inadequately. After removal of adenoids, soft palate is insufficient to close the nasopharynx. It results in hypernasality and incomplete removal of the adenoids. It is because of the blind operation and the adenoids are the diffuse mass which are not encapsulated. Secondary atropic pharyngitis. It is due to excessive stripping of the posterior pharyngeal wall. Grissel syndrome. It is most common in the Down syndrome. It is due to the post-operative inflammation in susceptible individuals like Down syndrome. Complaints are neck stiffness, neck pain, and throat pain. Velopharyngeal insufficiency, nasopharynx stenosis, recurrence, sometimes aspiration pneumonia, and otitis media may also be the complications. Thank you.